So our research is focused on how to improve the diagnostic of LAM, so of acute myeloid leukemia. And the approach that we are following is starting from bone marrow smears. We analyze some numerizations that has been done in a multi-level fashion, multi-zoom fashion, in order to have an automatic count of the different cell lines using AI techniques, so artificial intelligence techniques. So what is new with our approach is first the numerization in itself. Most of the papers just first select microscope pictures and then analyze these pictures, but there is a manual selection that is involved. In our case, we really have these multiple zooms available for the bone marrow smears. And so what we do is we implement different levels of selections for the tiles corresponding to this bone marrow. And this way we can, accelerate the process, because the selection is really done automatically. And so we use a combination of K-means techniques. We use some decision trees, really simple AI techniques in there to make a selection so that we get tiles which are, really not blurry, where the blood cells are really neat in there. And so that there is something that can be exploited. Then once we have the tiles, we do some segmentation. There we use convolutive neural networks methods. Mostly here for the pipeline that we were presenting in the poster, we use faster RCNN, which is one of the well-known neural networks that is used in these kinds of applications. And this allows us to extract the pictures of the cells from the numerization of the bone marrow smears. Once we have these cells, we can run some classification pipeline in there. So the idea is that we have extracted, for example, for the results that we present in the poster, we have extracted around 1,500 cells from different bone marrow smears from different patients, which were labeled manually by cytologists. So we differentiate in there all of the different cell types. And we focus first on whether a cell is a blast or is it non-blast. So that we extract some features from the cell. So it's a question of granularity, texture, size, etc. That we put in a table, and we use a simple algorithm called XGBoost, which allows us to do the classification in blast or non-blast cells. Thanks to just this dataset of 1,500 cells, we can already train a classifier that is able to find 92% of the blasts in there. So already for the diagnostic of AML, it is possible to already run this pipeline from the bone marrow smears, and just go through the pipeline and say, okay, this patient has more or less than 20% of blasts in his bone marrow, and so is it an AML or not? We also wanted to go a little further because there are different types of AML that we can differentiate. And so we tried to do a classification with 5 classes. So trying to find if a cell is blast, erythroblast, lymphocytes, granulocyte, monocyte. And we tried to do the same kind of classifier, so XGBoost, on these types of cells. One of the main issues being that in the case of the monocytes, in fact, we have a really low number of samples in there at the moment. And so we had to really do the classifier, train the classifier such that we have only 100 cells of each type in there, of each of the 5 classes. We are this way able already to have more than 80% accuracy for each cell line, except for the monocytes, which are known to be, in fact, the hardest to classify, even for cytologists, I mean. So with our research, we were able to develop some kind of tool, and the idea is that this tool can be used by cytologists in order to, well, really automatically analyze a bone marrow smear, and to have an idea of the counts and already do an automatic classification between AML or non-AML in there. It's really a tool that can help with the diagnostic for cytologists. I think the amount of data that we are able now to gather on patients and on, well, all of the previous results, in fact, we are no longer in an era where we have the files which are manually written, etc. We have really tools now to automatically, well, extract the information, store the information, and all of this information, which represents gigabytes of data, cannot be analyzed by human, not realistically. And so I think AI tools are really essential now if we want to be able to really exploit to the maximum these kinds of data. And this is particularly true in the kind of approach that we are doing, because, well, a cytologist who analyze a bone marrow smear, it takes a lot of time to do that. And also it doesn't take one cytologist. In general, you analyze the bone marrow of a patient, well, once by one cytologist, then it's checked by another one, and then by another one. So and in fact, statistically, they are. I think the idea is that they analyze 900 cells. The idea is to count 900 cells, and if you just use the numerization like that and with an automatic tool, well, there is no limit. You could analyze 10,000 cells. So even if you just have 95%, 90% of accuracy in your classification, well, in fact, you can already say that you would be at least as accurate as the cytologist. I cannot say at the moment that we may be better than the cytologist. This would be the ideal case, but it's still not the case. But at the moment, I think really it's essential to implement AI, at least to help the professional, the medical professional.